Hello guys, now we shall be discussing regarding the bony orbit. We shall discuss what are the contents of this bony orbit, and we shall also discuss what are the different structures that are passing through these foramens that are present within this bony orbit. Okay, and we shall also discuss what are the walls of the bony orbit. So first of all, what is this bony orbit? First of all, what is this bony orbit? Bony orbit is nothing but bilateral symmetrical cavities. Okay, you see bilateral, why bilateral? Because there are two symmetrical, the right one is exactly the same as the left one, and they are the orbital cavities, right, where your orbit or where your eyeball lodges there. Okay, so this is nothing but your bilateral symmetrical cavities. Okay, now first of all, before we discuss the walls of the bony orbit, first of all let us discuss what are the bones that are present in the bony orbit. So this is from the anterior view, right? So this is from the anterior view and this is from the lateral view. Okay, this is not left, this is lateral view and this is your anterior view. So anteriorly, what are the structures you have got? The first important structure which you can see over here, this particular one, this is called as your frontal bone. This is called as your frontal bone, right? You see frontal bone, this one, frontal bone is covering almost till the roof of the bony orbit. After the frontal bone, you see this yellow color bone over here, right? So this particular yellow color bone over here is called as your sphenoid bone. This is called as your sphenoid bone. Okay. Now after this sphenoid bone, this grape color bone which you can see over here, this is called as your maxilla. All of you know that this is maxilla. Okay, and next you see another bone in blue in color. This is called as a zygomatic bone. This is called as your zygomatic bone. Now these are the things that can be viewed from the anterior side very clearly. Okay, from the lateral side there are two more structures that you can view. You see this green color structure over here. This is called as your lacrimal bone. This is called as your lacrimal bone, and finally this orange color thing over here is called as your ethmoid bone. Is your ethmoid bone. So how many bones over we have here which form the bony orbit? We have got frontal, we have got sphenoid, we have got maxilla, we have got zygomatic, lacrimal as well as the ethmoid. So completely there are 6 bones, right? These 6 bones collectively form the orbit. Okay, so this bony orbit is formed by 6 bones. Now we will discuss what are the structures that are forming the roof, what are the structures that are forming the floor, what are structures that are forming the medial wall as well as the lateral wall. So first we will discuss over here what are the structures that are forming the roof. Roof is also called as your superior wall. Superior wall. Now you tell me, by looking at this picture, what are the structures that are forming the roof, right? So near these bones I will write it as R if it is roof. See here, don't you think that this frontal bone is forming the roof, right? Because see, this is called as a roof. Again I am telling you, if anyone don't know what is roof, see, the upward one is called as a roof, the downward one is called as a floor, and this is called as a medial and this is called as a lateral. Okay, now if you look at the roof, what are the structures that are forming the roof, guys? One is the frontal bones. You see, frontal bone is forming the roof. And next important thing, you can also see this yellow color bone that is also forming the roof. What is this yellow color bone over here called as? This yellow color bone over here is called as a lesser wing of sphenoid bone, right? So that is also forming the roof. So roof is formed by 2 structures. One is called as the frontal bone. One is called as a frontal bone, and second important one is called as the lesser wing of sphenoid. Lesser wing of sphenoid. Okay. Now after this, next let us see what are the structures that are forming the floor. What is the other name for floor? Floor is also called as your inferior wall. Okay. So floor is also called as your inferior wall. So what are the structures that are forming the floor over here? See, down I can see 2 colors. What are the two colors I can see? I can see this particular color. What is this? This is a blue color, and the second important color, that is a grape color, right? So these are the two structures I can see. So what are these two structures over here? See here also. This is the floor. Floor is formed by two bones, 1 and 2. Okay. So what are these two bones over here? One bone you call it as, you see, one bone you call it as maxilla, which forms the floor, and next zygomatic is also forming the floor. Okay. So the two bones which form the floor are, one is the maxilla and the second one is called as your zygomatic bone. Zygomatic bone. These are the two bones that form the floor. After that, let us see what are the bones that are forming the medial wall. What are the bones that are forming the medial wall? Again, let us look into the picture. See, this is the medial wall. Yes or no? So the wall over here is your medial wall. You can also see the medial as well as the lateral wall also, but very clearly you can see the medial wall. So here the medial wall is formed by few bones. See, the first bone, this is the first bone. What is this? Maxilla. Second, what is the second bone? Lacrimal bone. You see, the green one is called as your lacrimal bone. And third important bone, see, this is the third one. What is this third one called as? Your ethmoid bone. And if you look here, you see, so this is your 1, this is your 2, this is your 3, and this is your 4, right? So very partially, I know it is not that clear in this picture. See, in this picture it is not that clear, but very partially, if I am rubbing this red color line, right, you can see a small yellow color bone over here, right? That is also forming the medial part, right? So in the medial part, 4 bones are formed, out of which 3 bones are very clearly visualized in this picture, and the 4th bone is not properly visualized there, and that is called as your sphenoid bone. So what are the structures that are forming the medial wall? One is your ethmoid bone. Second one is your maxilla. Third one over here is your lacrimal bone, and fourth important one is your sphenoid bone. Sphenoid bone, right? So these are the structures that are forming the medial wall. Now let us look at what are the structures that are forming the lateral wall. What are the structures that are forming the lateral wall? So if you concentrate on the lateral wall, so how can you look at the lateral wall? Lateral wall you can look from the anterior view itself. See, in the anterior view itself, lateral wall is formed by, see, this is one bone. What is this bone? This bone is called as your zygomatic bone. And not only that, even the second bone, that is a sphenoid bone, is also forming the lateral wall. Okay. And by the way, what is this part of the sphenoid bone which is forming the lateral wall? This is a greater wing of sphenoid. So in this picture, you cannot differentiate greater wing and lesser wing, right? Unless and until you look at the skull from all the directions, right? So if you look at the skull from all the directions, very clearly you can identify which is a greater wing of sphenoid, which is a lesser wing of sphenoid. So in a separate video on sphenoid bone, I have explained you the greater and lesser wing of sphenoid. Okay. So what are the two structures that are forming the lateral wall? One is your zygomatic bone, and the second one is your greater wing of your sphenoid bone. Greater wing of your sphenoid bone. Okay. Right. So these are the structures. So what are the structures? Let us discuss what are the structures that are forming the apex. Okay, so what are the structures that are forming the apex? If you look at the structures that are forming the apex, I know the skull is not that clearly visualized because some of the bony fragments have been broken off, right? But I just wanted to show you, I'm not here to show you the foramens here. 100% you won't see these foramens, right? So, but what I want to tell you is that if you look at the bony orbit, how is this bony orbit? This bony orbit is not concave like this. Rather, this bony orbit is in this way, right? So, in another way I have to tell you, bony orbit, right? If you look at the wall of the bony orbit, this is not in this way, okay? Rather, the bony orbit is pointed like this. You see? Here, this is pointed in this way. Now, in this pointed bony orbit, what are the things you can see? You can see the roof, you can see the floor, right? You can see the medial wall, you can see the lateral wall, and all my fingertips where they are meeting there, that is called as the apex. So inside if you see, the bony orbit is in this way, right, in this way, not convex, right. So the apex is having a foramen, and that foramen over here is called as optic foramen, or you can also call it as optic canal, where the structures like optic nerve and vessels, they pass. Okay, right. Now let us look at what are the structures we have discussed over here. We discussed roof or superior wall. Just look at the picture here. Roof or superior wall is consisting of, one is called as your frontal bone, another one is called as your lesser wing of sphenoid. In the picture itself it is very clear. Next, the floor is consisting of maxilla and zygomatic. See here, the floor is consisting of this blue one called as the zygomatic bone, and this purple one over here which you can see. You see this particular one, right? This is called as your maxilla. Okay, this particular one is called as your maxilla, and this one is called as your zygomatic bone. So these are the two bones that are situated over here. Okay. So where are they located? Zygomatic as well as the sphenoid bone, the zygomatic bone, they are present to the floor. So one is called as your maxilla, another one is called as your zygomatic bone. Third important thing is called as your medial wall. To the medial wall, what do you have? 1, 2, 3 and 4, which you cannot see. The fourth one you cannot clearly visualize over here, right? So the first bone which you can see over here, right? The first bone, this first bone over here is called as your maxilla. Okay, see, you see this bone, this is called as your maxilla. After maxilla, deep inside here, this is broken here. Maybe let us visualize here, right? This bone over here which you cannot see, I know you cannot see this. This is called as your lacrimal bone. And deep inside ethmoidal, and much more deep inside, you have got the sphenoid bone again. Again you have got the sphenoid bone. Okay. So they form what? They form the medial wall. So these four structures form the medial wall. Next, coming to the lateral wall. Lateral wall is formed by what? Lateral wall is formed by, one is called as a zygomatic, another one is called as a greater wing of the sphenoid. And lastly, we have got apex or the apical region. See, this is the apical region where you have a small foramen here. See, this is the apex like this, right? So in this apex, you have got a small foramen like this, and this foramen over here is called as your optic foramen. Let us see what are the contents. See, what are the contents over here. Within this orbital socket, we have got eyeball. One is we have got eyeball. Next, we have got eyelids, right? And we have also attached to the eyeball, we have got some muscles. What are those muscles? They are called as extraocular muscles. We have discussed the extraocular muscles. So one is we have got the eyeball, we have got the muscles that are attaching to the eyeball, that is extraocular muscles. We have got eyelids like superior eyelid and inferior eyelid, or upper eyelid and lower eyelid, and along with that we have also got nerves. So let us write down what are the contents of this bony canal. So let us discuss what are the contents of the bony orbit. So regarding the contents of the bony orbit, the first important content which you can see over here is your extraocular muscles. Extraocular muscles. One is your extraocular muscles. Second important thing over here is your eyelids. Third important thing over here is your nerves, right? And obviously, do you have eyeball or no? You even have eyeball. Fourth important thing is your blood vessels and nerves. Blood vessels as well as nerves. So nerves we have already discussed above. So now what are the different kinds of nerves which you have got over here? The different kinds of nerves which you have got over here are the first important nerve. Right. The first important nerve which you have got over here is optic nerve. One is optic nerve. Optic nerve. What is optic nerve? Optic nerve is your cranial nerve number 2. So olfactory, optic. After optic we have got oculomotor nerve. Oculomotor nerve. What is oculomotor nerve? Cranial nerve number 3. Third important thing is trochlear nerve. What is trochlear nerve? Trochlear nerve is cranial nerve number 4. Okay. So, after trochlear nerve, next we have got what? Trigeminal nerve. And again, what is this trigeminal nerve? Cranial nerve number 5 is called as your trigeminal nerve. Now, last nerve is your abducens nerve. Abducens nerve is your cranial nerve number 6. So, how many nerves we have got? We have got nerves like 2, 3, 4, 5, 6. Okay, starting from the optic. Why are you starting from the optic? Because we are discussing about the bony orbit where your eyeball is present, right? So, extraocular muscles, eyelids, nerves, blood vessels, these are the structures that are present. Now, coming to the blood vessels, specifically coming to the blood vessels over here, let us discuss what are the different kinds of blood vessels you have got. Okay, so basically, let me write it down here. Basically, we have got two important blood vessels. What are those two important blood vessels? One is called as your, obviously, you are discussing about the ophthalmic region. So, the artery over here will be ophthalmic artery. So, there will be ophthalmic artery. Okay. Now, when I discuss artery, there should be vein. So, what is the vein called as? Ophthalmic vein. But there are two ophthalmic veins, one on the top, one on the bottom. That is called as superior ophthalmic vein, and the next one is called as the inferior ophthalmic vein. Superior and inferior ophthalmic vein. Superior as well as inferior ophthalmic vein. So, these are the structures that are located here. So, these are the contents of the bony orbit. Okay. So, extraocular muscles, eyelids, nerves 2, 3, 4, 5, 6 and blood vessels like ophthalmic artery as well as superior and inferior ophthalmic vein. Next important thing is that, for example, if you wanted to enter deep inside the orbit, what are the different pathways? What are the different pathways are? For example, what I am trying to tell you is that, see, for example, let us say this is your orbit. Okay. And now we will be discussing about what? We will be discussing about the pathways into the orbit. Pathways into the orbit. So, basically, what are the different pathways you have got? See, if you look into the orbit over here, if you look into the orbit, deep inside the orbit, you have got a small opening. This opening, I told you, it is called as optic foramen or optic canal. So, with the help of this opening, what you can send the structures from the eyeball deep inside your orbital content, right? So, what is the first opening over here? This opening over here is called as your optic canal. This is called as your optic canal. After that optic canal, here you have got one more structure. Here you have got one more structure like this. This is called as a fissure. In the same way, you have got one more structure like this. This is also called as a fissure. Now, what is this structure which is located on the top? This is called as superior orbital fissure. This is called as superior orbital fissure. After the superior orbital fissure, this fissure over here is called as your inferior orbital fissure. So, two fissures you have got. One is called as a superior orbital fissure, another one is called as the inferior orbital fissure. So, with the help of these fissures only you are able to send some structures inside. Now, what exactly I mean by that? What exactly I mean by that is that I will try to just draw it in another view. Let us say this is your orbit. Okay. Let us say that this particular thing is your orbit like this. This particular thing is your orbit. Now, inside this orbit over here, you have got one small opening over here, right? You have got another opening like this. You have got another opening in this way. What I am trying to tell you is that, see, there is, okay, let me draw these openings a little bit wide. See, there is one opening on the top, there is one opening here, there is one opening on the bottom. So, the opening on the top is your optic foramen, next you have got superior orbital fissure and then inferior orbital fissure. So, what I am trying to tell you is that, let us say there is one nerve that is coming all the way, entering into this, and this nerve is coming out like this. Okay. In the same way, there is one more structure like this, that is entering into the superior orbital foramen, and it is coming all the way through the canal, and it is coming out in this way. You see, there are some structures that are going inside and they are going back through that foramen and through that fissure. So this is what I mean here. If I show you this picture, it will be very clear for you, right? So this is your orbital content, right? You know what are these bones now, right? Let us just name these bones. See, this bone over here is called as your maxilla. This bone over here is called as your lacrimal bone, and this bone over here is called as your sphenoid bone, right? Sorry, not sphenoid, this is called as your ethmoid bone, and this bone over here is called as your sphenoid bone. These things we discussed, right? Now here you can see three important openings. See, this is one opening over here, okay? If you want, I'll use another color. Yeah, this is a one opening, and you can see one opening here, and you can see the third opening here, right? So what are these openings over here? See, this particular opening over here is called as your optic canal, and this one over here is called as your superior orbital fissure, and this one over here is called as inferior orbital fissure, superior orbital fissure as well as inferior orbital fissure. Now, first what we shall do is that let us see what are the structures that are passing through superior orbital fissure, then what are the structures that are passing through inferior orbital fissure. For example, the structures that are passing through superior orbital fissure are, the first one is the lacrimal nerve. After the lacrimal nerve, the next nerve which is passing all the way is your frontal nerve. After the frontal nerve, the third nerve that is passing is your fourth pair of cranial nerve, that is called as your trochlear nerve. That is cranial nerve number 4. Okay. Now after that, next two important structures that pass, one is called as the third pair of cranial nerve and the other one is called as the sixth pair of cranial nerve. Third pair of cranial nerve is your oculomotor nerve, that is your cranial nerve number 3. Fourth pair of cranial nerve is your abducens nerve, that is your cranial nerve number 6. Okay. So these are the structures that are primarily passing through your superior orbital fissure. Now what we shall do is that let us see what are the structures that are passing through inferior orbital fissure. Actually, there are only three important structures that are passing through this inferior orbital fissure. Okay. Now what are these three important structures? The first important structure is maxillary nerve, right? We have got ophthalmic, we have got maxillary, we have got mandibular. All these are the nerves of trigeminal nerve, right? So when I am discussing about maxillary, ophthalmic is called V1, maxillary is called V2, mandibular is called V3. Now when it comes to maxillary nerve again have got some branches. Out of this, one branch is called as a zygomatic branch. Okay, so zygomatic branch of maxillary nerve. Zygomatic branch of maxillary nerve is one. Second important thing, as it is an inferior orbital fissure, so the vein that is passing is inferior ophthalmic vein. Next important thing is that there are a group of nerves also that pass, they are called as sympathetic nerves. So these are the structures which you can see. What are the structures that are passing through the superior orbital fissure? So you have got structures like lacrimal nerve, frontal nerve, cranial number 3, 4 and 6. Next important thing is inferior orbital fissure. Zygomatic branch of maxillary nerve, inferior ophthalmic vein and sympathetic nerve. So these are the structures that are passing through the inferior orbital fissure. Next important thing is that if you look at the orbit, you see the border of this orbit, right? So this border of the orbit is nothing but called as the rim of the orbit. So mostly there are two types of fractures that can happen. One type of fracture is called as orbital rim fractures Another one fracture is called as blowout fractures. To the orbit, mainly two fractures can happen. One is called as orbital rim fractures and the second one is called as a blowout fractures. So what is orbital rim? I told you the rim is broken. You see, let me draw the rim over here, right? You see the rim over here is broken, right? If I draw another rim over here, you see another rim is also broken. Here also if I draw a rim, you see the rim is broken over here. So these fractures which you can see over here, right, in this picture it is not that clear, right? These fractures or whatever you can see here, these are called as orbital rim fracture. Okay, these are called as orbital rim fractures. Next important thing, one thing you need to know here is that if you observe this orbit, let me duplicate this. If you observe this orbit, one very important finding you will see here. So far we discussed orbital rim fracture. What is orbital rim fracture? If this is the rim, right? If this is the rim and this rim is disrupted or fractured anywhere, that is called as your orbital rim fracture. Now, which is the medial wall and which is the lateral wall, guys? See, this wall is called as the medial wall, and which is the inferior wall? See, this wall over here is called as your inferior wall, right? So there are two walls. One is called as your medial wall and this one over here is called as your inferior wall. What I am trying to tell you is that the medial wall and inferior wall are the weakest walls. Okay, medial and inferior wall of the weakest walls, and these walls are more prone to fracture. Okay, so that fracture, when you see, when there is a fracture of medial wall and inferior wall, such fractures you call it as blowout fracture. Blowout fracture. Why? The medial wall and the inferior wall are the weakest parts, weakest walls. So the fracture associated with that will be the blowout fracture. So again, what is this? This is what? This is a rim fracture. This is also a rim fracture. You see the rim is fractured over here. Now look at this fracture over here. Now in this fracture you see this is called as your medial wall and this one is called as your inferior wall. So the medial wall and inferior wall will be broken. These fractures are called as blowout fractures. Now out of these two, which fractures are very dangerous are blowout fractures. Why? Because once the medial and the inferior wall are broken, you know what will happen? All the contents of the orbital cavity, whatever it might be, the fluid, the blood, right? So all this fluid and blood, they start draining into these sinuses. What are these sinuses? These sinuses are nothing but called as your ethmoid sinuses. So they start draining into these sinuses, and that is the reason why whenever there is a fracture on the medial side here, you will see a swelling. Let us just look at this scan over here. You see, let us first discuss the right orbit. Right orbit, the superior wall is fine, the lateral wall is fine, the inferior wall is fine and the medial wall is fine. Now just look at this and tell which walls are thick over here. Superior wall is thick, yes or no? Superior wall, it is thick. Lateral wall is much more thick, right? But look at inferior and medial wall. As I already told you, inferior and medial wall are the thinnest parts. You see, medial wall is very thin, inferior wall is very thin. Okay, and you see these openings here, these openings are nothing but called as your ethmoid sinus. I am removing these openings, but these openings whatever are there, these are nothing but called as your ethmoid sinus. Ethmoid sinus. Now look at this picture. In this picture, if you see where is the fracture? Let us start discussing from the superior wall. Superior wall is fine, yes. Lateral wall is fine, yes. Look at the medial wall is also fine. But look at the inferior wall. You see the inferior wall is broke open over here, right? When the inferior wall will break out, all the contents whatever are there, they start draining down into the sinuses. So what will happen? You would see a swelling infraorbitally. It means below the orbit. So this is how you see a swelling in a patient. Okay, so this indicates that the patient is having what? Fracture to the lower orbit, the lower wall. So such fracture is called as a blowout fracture. Another fracture which we discussed was orbital rim fracture. So there are mainly two fractures which you have to know. One is called as the orbital rim fracture. Another one is called as your blowout fracture. Blowout fracture. So there are two fractures. orbital rim as well as the blowout fracture. These are the two fractures which you basically see in a patient. Okay. So let us just revise the things which we have just discussed right here, guys. So we started our discussion with the bony orbit. I told you that the bony orbit is having 6 bones. And what are those 6 bones? Frontal bone, sphenoid bone, right? Maxilla, zygomatic, lacrimal as well as the ethmoid bone. Now here the roof is consisting of what structures? Roof is consisting of the frontal bone, lesser wing of sphenoid. Floor is consisting of maxilla and zygomatic, right? It would be better if you look at the picture and then answer these questions. Medial is ethmoid, maxilla, lacrimal and sphenoid. There is no mnemonic for this. Just looking at a picture will help you answer this. Lateral wall is having zygomatic and greater wing of sphenoid. Apex is having what? Optic foramen or optic canal. Next important thing is contents of bony orbit. The first important content is your extraocular muscles, second is your eyelids, third is your nerve and fourth is your blood vessels. Coming to the nerves, you have got cranial number 2, 3, 4, 5 and 6. Artery, ophthalmic artery, vein, that is ophthalmic vein, superior and inferior ophthalmic vein. What are the pathways that are allowing you to enter into the orbit? One is your optic canal, superior orbital and inferior orbital fissure. So structures that are passing through the superior orbital fissure are cranial nerve number 3, double the time 3, it is 4. After 3 it would be, double the time 3 it is 6 and after 3 it would be 4. So 3, 4 and 6. Lacrimal nerve and frontal nerve additionally. Inferior orbital fissure, zygomatic branch of maxillary, inferior ophthalmic and sympathetic nerves, right? So this is the medial wall and the inferior wall which are very weak, I told you, which are more prone to fracture, and such fractures are called as blowout fractures, right? So orbital rim fractures, you know the other walls. So this is all you need to know regarding the bony orbit, guys. So thank you so much for watching my video. Goodbye.